Hello and welcome back to another episode of the Health Talks. I'm Dr. Shahad Abulanain and I'm the host of the podcast. As part of Brain Awareness Month this June, we're shedding light on one of the most important and complex systems in the human body, which is the brain and nervous system. Neurological conditions can affect people of all ages and can present with symptoms that are often ignored, misunderstood, or dismissed until they become more serious. From persistent headache and spine problems to brain tumors and strokes, early intervention and awareness can make a significant difference in patient outcomes. In this episode, we'll be discussing brain and spine health, stroke awareness, modern neurosurgery, as well as the latest interventions and innovations in neurological care. And to help us understand this better, I'm joined by Dr. Vinay Kumar Gurumath, who's a specialist neurosurgeon at Thumbay University Hospital in Ajman. Welcome, Dr. Vinay, and thank you very much for being here with me today.
Thank you, Dr. Shahad. Thank you for having me here today.
It's a
I'm
pleasure.
glad to have a conversation with you today. Let's start.
It's a pleasure having you. So, Dr. Vinay, people, when they hear the word neurosurgery, they get intimidated. So, can you tell us more about what neurosurgeons actually do?
Neurosurgery is just like any other surgical branch where we are basically trained to handle the cases related to your nervous system, means like brain and spinal cord. Let me disabuse our audience from the notion that neurosurgeons operate only on the brain, complex brain tumors. In reality, it's not so. We not only operate on the brain, but also on the spinal cord and spinal nerves and peripheral nerves as well. And to start with, you said neurosurgery as intimidating. I don't agree with that. Previously, it used to be perceived as intimidating because of long-standing misconceptions, but in this day and age of modern science, neurosurgery has become a much more safer and precise. So I don't think it's anymore as intimidating.
Right, I couldn't agree more with you, Dr. Vinay. And what are the common conditions you see on a daily basis as a neurosurgeon?
On any given neurosurgery OPD days, I'll be getting spine-related conditions more often than the brain-related conditions. To mention a few cases like chronic neck pain, back pain, what you call as the spondylosis cases, herniated discs, spinal tumors or a spinal trauma. Also, the brain-related conditions like brain tumors or hypertensive bleeds or stroke-related conditions. We often come across these cases.
Right, and such conditions, do they take time to develop, or do they happen suddenly, or how do you see patients present?
It can be either way. There are few neurosurgical conditions which happen suddenly, dramatically, from nowhere they appear. Right. But there are other conditions which take their long time, often unbeknownst to the patient itself, remaining indolent for a long time. Right. To give examples like stroke or aneurysmal bleeds which happen suddenly, and there are a few cases which take a long time, like some benign tumors or chronic degenerative conditions of the spine like disc herniations. They often take a long time before they show the symptoms.
Right, and when people hear the word tumor, they often think of cancer. So are all brain tumors cancerous, Dr. Vinay?
No. Majority of the brain tumors are benign actually, like if you take 70 to 75% of the brain tumors are benign and the remaining are malignant. When we say benign and malignant, malignant means like aggressive kind of a tumors which goes very fast, invading the other brain structures, destroying them. Benign means slowly growing tumors. But when it is about neurosurgery, benign doesn't mean harmless, because there is a finite intracranial space, and the brain itself being a sensitive structures, even the benign tumors can pose a significant health threat.
Right, and how do you diagnose these brain tumors, Dr. Vinay?
Diagnosing any brain tumor or any tumor, it's through concatenation of a clinical assessment, laboratory findings, imaging studies, and also the histopathological confirmation. So when the patient comes to us, we go through the thorough assessment of the patient's symptoms and clinical examination if the patient is having any deficits because of the brain tumor or the lesion. Through that clinical assessment, we will be able to surmise which part of the brain is getting affected.
Right.
So then we go for a MRI or CT depending on the patient's needs each CT and MRI gives, they are having their own pros and cons. However, with the imaging studies, we will be able to have a idea about the tumor size, location, how close is it to the critical structures, and nature of the tumor. Then additionally we can get some, in some selected cases we get information about the tumor through the laboratory findings also. And after the surgery, we subject that tumor piece to the histopathological examination, which gives us a clear idea about what type of the tumor it is and what is the grade of the tumor. So through all these assessment, lab and imaging and the surgical biopsy, that is histopathological confirmation, we come to know the exact tumor, what it is.
Right, so it's a very comprehensive process, Dr. Vinay, from assessment at the clinic to scans, labs, and also intervention to take a biopsy to know the full picture of the brain tumor. Amazing. And what do you say is, like, how important it is for youngsters and elderlies to maintain good brain health? It's not restricted to one age group, right?
No. It is irrespective of the age and gender, because whatever you do on a daily basis, like your thinking, thoughts, your movements, your interactions, memory,
Right.
everything is governed by the brain. So it is irrespective of your age. Having the good brain health is important.
From your experience, Dr. Vinay, what are the symptoms people should never ignore when it comes to neurological conditions, and what are the warning signs that should trigger them to immediately see a physician?
To answer this one succinctly, whatever that appears suddenly and severe enough symptoms, don't ignore that one. Or whatever that symptoms that deteriorates rapidly,
Right.
don't ignore. And whatever those symptoms, whichever is associated with your sensory changes like numbness, loss of sensations or pain, or any motor deficits. Suppose you suddenly started having a weakness in your arms or legs, foot drop, don't ignore. So whatever that appears suddenly and deteriorates rapidly and associated with your changes in the sensation or the motor, never ignore those things.
Right, and people always experience neck pain, back pain. When can these symptoms actually indicate a more serious spinal problem, and when should they seek immediate medical care?
It's a good question, because having the neck pain and back pain is very common. Most of the times it is because of the just a muscle strain or spasms.
Right.
Suppose if your symptoms are indicative of any significant compression of the nerves, spinal cord or something. What I mean by that one, if you have a progressive pain, radicular pain, or loss of sensation in the hands or limbs, or if you have any weakness in your arms, legs, foot drop, or any bowel bladder disturbances, these indicate the nerve being pinched or compressed significantly. You should never ignore such symptoms.
Right, and people experience disc problems increasingly nowadays. Do all disc problems need surgery, or can they resolve with other medications?
Not at all. Majority of the symptoms, especially in case of spinal problems, can be managed conservatively. So what we do is, initially we try to manage this with the medications, adequate bed rest, physiotherapy,
Right.
and graded movements and lifestyle modification. So with these things, in majority of the cases, say 97-98% of the patients will be able to manage conservatively. Suppose in case the patient is coming to you for the first time with red flag symptoms itself, like in such patients we have to go for a surgery. Otherwise it can be managed conservatively.
So therapy is always started with conservative management, and then surgery is usually the last option.
Yes. Hardly 1 to 2% will require a surgery.
Amazing. And Dr. Vinay, from your experience, what are the habits that you've observed people do that contribute to bad spine health eventually?
It's a very important question. So it is like lack of activities, having a poor posture while sitting or standing, poor ergonomics at workplace, and if your job is involving a repetitive bending, twisting kind of movements, having a sedentary lifestyle, smoking and alcohol, all these lead to your getting a back problems.
Right.
So that's why we always say lifestyle modification is imperative in treatment of spinal related problems.
Amazing, and thank you very much for emphasizing that, Dr. Vinay.
Definitely.
Now, moving on to stroke awareness. Stroke is a very serious condition that can affect people. What are the signs that they should recognize immediately and seek medical care when it comes to strokes?
Stroke is an emergency. You should always know that is the emergency medical conditions. Time counts in the treatment.
Exactly.
So having a basic idea about like what all the symptoms makes a lot of differences.
Right.
So to tell your audience, what I say is we have a mnemonic called BEFAST, BEFAST. So what does that mean? B for any imbalance, E for eye changes, F for face drooping, A for arm weakness, S for any speech disturbances, slurring of speech, T is it's the time to call ambulance 998. So it depends which part of the brain is affected. If the part of the brain related to the vision, then patient have a visual disturbances. If it is sleep, then slurring of speech. So depending on the location, symptoms vary. But grossly, if you can remember this mnemonic, that will help you.
Amazing. It's very simple to remember, exactly BEFAST. And thank you very much for explaining it, Dr. Vinay. Now, if someone sees a person around them, whether a family member or a friend, experience a stroke and they're familiar with the symptoms, what should they immediately do?
If you are suspecting anybody having a stroke, then don't waste your time. Just take the patient to the nearest stroke center with all the facilities, and if possible, you can assess the fast symptoms. That's one thing. And the second thing is, especially we have noticed patients being given BP medications or diabetic medications while the patient is already having a stroke or drowsy. So don't do such things. Just to take the patient to the nearest stroke center.
Right. So that's a very risky move.
Yeah.
Exactly. Okay. So early intervention can lead to better outcomes, you say?
Yes, very true.
So can early intervention prevent like permanent neurological damage, Dr. Vinay?
Definitely. As we know, it's a medical emergency. Time is very critical. To emphasize the importance of a time, we phrase it, a time is brain. In a cardiac arrest, you might have heard time is a muscle. Similarly, we have named it as a time is brain, because timing is that much given importance. Because what happens in a stroke is there will be interrupted blood flow to the part of the brain. Each minute passing by, with each minute of delay in blood flow to the organ, that part of the brain, it's going to lose its functionality permanently.
Right.
So with each 1 minute, you are going to lose around nearly 2 millions of neurons permanently. So it's very important to have a early intervention. Not only that one, the time also decides which type of treatments you are going to get. If you have a stroke and diagnosed within 4 or 5 hours, you will be given just medications to burst the clots. That's what we call as the thrombolytics.
Right.
That will be sufficient at that moment. Suppose if it is delayed beyond 4 or 5 hours, then we have to go for that thrombectomy, where we remove the clots. And if suppose even if it is delayed beyond that one, once the brain is damaged and there will be a brain swelling affecting the normal brain also, then we have to go for a surgical decompression kind of a thing. So timing decides the management, what kind of a treatments you are going to get, and it also affects your outcome. The more the delay, the poorer the outcome. So we have to get early treatment.
Right. So the sooner the patient comes in, the less invasive the intervention is.
Definitely,
so they can get oral medication that helps dissolve the clot, and they can have better outcomes.
Very true.
So time is very sensitive,
Very
Dr.
true.
Vinay, like you said. So what are the factors that increases the risk of stroke actually in patients?
Apart from your age and genetics, most important things are uncontrolled blood pressure, uncontrolled sugars, cholesterols, high cholesterols, and some cardiac conditions related to the what you call as arrhythmias, fibrillations, those kind of things, sedentary lifestyles, and smoking, alcohol. All these lead to a stroke.
Right. Thank you very much for highlighting that, Dr. Vinay. Now, you work at the Thumbay Institute of Neurosciences, one of the very advanced institutes in the country. If a patient has symptoms that they're concerned of, like tingling, a loss of sensation, the persistent headache, any spine problem, what does their journey look like at Thumbay University Hospital?
Your typical journey from painful symptoms to recovery would be like step by step, evidence based, smooth journey, considering keeping the things safe and time efficient as much as possible. We have a good OPD services here round the clock and good emergency services with all the imaging modalities available.
Right.
We have a good team of doctors for multidisciplinary review in case of any complex cases. We have a ICU with cutting edge technologies, and we have state of the art OT services. And to complement our care, we have one of the best neuro rehabilitation center it's one of the best in the Northern Emirates. So your journey is going to be smooth. That I can assure on that.
That's very reassuring, Dr. Vinay. And like you said, it's a very comprehensive team of multidisciplinary experts, and the patient's experience is definitely holistic. From the patient is taken care of from all aspects.
Yeah.
So, Dr. Vinay, when people hear neurosurgery, they get intimidated that it can be a serious intervention and there's a lot of risk involved. How has neurosurgery evolved in the years, and how advanced is it now, and how has the risk decreased?
See, it's quite natural to get anxious and feel intimidated when you say about neurosurgery. It's quite natural because everybody knows that brain being a very critical and sensitive structure. Neurosurgery has evolved a lot over a period of time. So it has become much more precise and safe than ever before. Previously, 1 or 2 decades ago, we used to operate based on the primitive CT imaging alone. But we have now MRI and other imaging modalities with the different sequences. And intraoperatively, we have neuro navigation systems which acts like similar to your GPS, giving in a real time. It gives an idea like what is the shortest way to operate, like surgical corridors, and which is the safest surgical corridor to operate. And we have neuro monitoring systems where in a real time it gives a feedback whether we are injuring the nerves or not. We have minimally invasive techniques to reduce the post-operative morbidities, and the ICU care and anesthesia. There are a lot of advancements are there already, and more than that, we have a good understanding of the brain now. So there is no need to fear about neurosurgeries. It has become a safe and precise than ever before, actually.
Right, and with technology, there has been more clarity before going into surgery. Like you said, there are minimally invasive procedures that patient can undergo and investigations that help give a more comprehensive picture of the condition, and which eventually minimizes the risk of any failure or adverse effects in surgery.
Yes.
Thank you very much for highlighting that, Dr. Vinay. Now, lastly, if you could give our listeners a takeaway message about their brain health in recognition of Brain Awareness Month, what would you tell them?
Brain awareness, it's something that you have to think about throughout your life, not like only when you get some crisis or something goes off.
Definitely.
And
yes.
Whenever you get any symptoms, take it seriously, not out of fear. Just try to have early consultation. Having an early consultation is not an overreaction. It is the best way of protection, actually. Don't delay in seeking care. We will be available round the clock at Thumbay Institute of Neurosciences to help you out.
Amazing. Thank you very much for that encouraging message, Dr. Vinay. It was a pleasure having you today.
Thank you. Thank you.
And thank you very much to our listeners for watching us and listening to us till the end. See you in the next episode.